Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 12 Diseases that can cause dehydration in adults. Dehydration occurs when you lose or use more fluid than your body takes in. It leaves your body lacking the fluids it needs to function. Without treatment, chronic dehydration can increase your risk of severe damage to key body systems such as your brain, heart, and kidneys. /r/n/r/n Despite an attempt to consume healthy water levels, other factors can increase your risk of dehydration. It can occur as a result of diarrhea, vomiting, fever, extreme sweating, or frequent urination. You also have a higher risk of dehydration if you have certain illnesses that damage the way your body uses and maintains liquid. /r/n/r/n/Halfpoint, Getty ImagesrnrnKnow. Know the signs of dehydration so you can work to replenish lost fluids or seek medical care before your condition worsens. Symptoms of dehydration can include :r/n/r/n Celiac disease is a chronic autoimmune disease that damages your small intestine. It is triggered when affected people consume foods that contain gluten, a protein found in wheat, rye, barley, and certain other grains. Treatment involves following a gluten-free diet. /r/n/r/n In celiac disease, gluten promotes an immune response that attacks the villi, small finger-like projections that line your small intestine, which are responsible for nutrient absorption. Damaged villi can increase your risk of malabsorption, an inability to absorb minerals and vitamins from your food. /r/n/r/n Diarrhea is a common symptom of malabsorption in celiac disease. Dehydration can occur as a complication of diarrhea as your body loses more fluids than you can take in. In rare cases, people with celiac disease can develop diarrhea that causes severe dehydration, weight loss, and metabolic abnormalities in a situation called a celiac crisis. /r/n/r/n Symptoms of celiac disease can vary among individuals. It is possible to have celiac disease but not have noticeable symptoms. When they occur, symptoms of celiac disease in adults can include /r/n/r/n Sjgrens syndrome is a chronic autoimmune disorder that affects your entire body. While the disease can occur alone, about 50% of people with Sjgrens syndrome have another autoimmune connective tissue disease such as lupus, rheumatoid arthritis, or scleroderma. /r/n/r/n Sjgrens syndrome causes problems when your immune system attacks moisture-producing glands and tissues. These areas include your salivary glands, which make saliva, lacrimal glands, which make tears, and mucosal membranes, which make mucus. /r/n/r/n Sometimes, your immune system can attack other body parts, damaging organs and tissues. Dehydration can occur as the disease affects your body's ability to regulate fluid and electrolytes, minerals that your body needs to balance water levels. /r/n/r/n Other symptoms of Sjgrens syndrome are /r/n/r/n Ulcerative colitis is a type of inflammatory bowel disease, IBD, that causes inflammation and ulcers, open sores, on the inner lining of your large intestine, your colon and rectum. It usually occurs as the result of an overactive immune system. /r/n/r/n Inflammation from ulcerative colitis can inhibit adequate water and electrolyte absorption, magnesium, sodium, zinc, phosphorus, potassium, causing dehydration. Your large intestine is responsible for water and electrolyte absorption and cannot perform this normally when it is damaged. Additional conditions common in ulcerative colitis, such as frequent and watery diarrhea, can also contribute to dehydration. /r/n/r/n Other symptoms of ulcerative colitis can range from mild to severe. Many people have symptoms balanced by periods of remission, times when symptoms disappear. Symptoms can include /r/n/r/n Cystic fibrosis is a progressive genetic disease. In people with cystic fibrosis, Mutations in a gene called the cystic fibrosis transmembrane conductance regulator, CFTR, damage the CFTR protein. When this protein is dysfunctional, it cannot move chloride, a component of salt, to the cell surface. Without chloride to attract water to the cell surface, the mucus in various organs becomes thick and sticky. /r/n/r/n People with cystic fibrosis have a higher risk of dehydration because they lose more sodium, salt, from their bodies than the average person. When a person with CF is active in recreational activities, becomes ill, or the weather is excessively hot, they lose more sodium, salt, from their body than the average person. /r/n/r/n People with cystic fibrosis also have a thirst sensation that does not turn on as efficiently as it does for other people. Usually, salt levels in your blood climb when you sweat, triggering thirst. However, when too much salt is lost, as occurs in cystic fibrosis, you may not feel thirsty even if you have lost a lot of body fluid. /r/n/r/n Other symptoms of cystic fibrosis can occur as a result of mucus that becomes thick and sticky rather than thin and slippery. Thick mucus can cause blockages and clog your organs. This interferes with normal organ function and leads to /r/n/r/n Crohn's disease is a chronic inflammatory bowel disease that affects the gastrointestinal (GI) tract. It can cause inflammation in any part of the tract but usually affects the small intestine and the top of the large intestine. Research indicates that Crohn's disease may be an autoimmune disease, though its specific cause is unknown. /r/n/r/n Diarrhea and vomiting associated with Crohn's disease can lead to severe dehydration in some people. Dehydration in Crohn's disease occurs when you lose more fluids than you replace. Dehydration can be a life-threatening condition if left untreated. /r/n/r/n Other symptoms of Crohn's disease can include /r/n/r/n Diabetes is a chronic disease that interferes with your body's ability to convert food into energy. When you eat, your body breaks down the food you consume into glucose, a type of sugar. When this sugar enters your bloodstream, your pancreas releases insulin, a hormone that pushes sugar into your body's cells so they can make energy. /r/n/r/n Diabetes can interfere with the production of an adequate amount of insulin or the proper use of insulin. This leaves too much glucose in your bloodstream, without it reaching your cells. /r/n/r/n Diabetes can increase your risk of dehydration because your kidneys typically reabsorb blood sugar. However, the elevated blood sugar levels that occur with diabetes can stress your kidneys. /r/n/r/n As a result, the extra sugar passes into your urine along with extra fluid, making you urinate more frequently. Your body draws fluid from your cells if you are not drinking enough to replenish the extra fluid needed to flush out the extra sugar. As you excrete more fluid than you consume, dehydration can occur. /r/n/r/n Other symptoms of diabetes include /r/n/r/n POTS, postural orthostatic tachycardia syndrome, is a blood circulation disorder. It is one of a group of conditions characterized by orthostatic intolerance, which causes tachycardia, rapid heart rate, and a drop in blood pressure when moving from a seated or lying position to a standing position. /r/n/r/n Problems occur because your body cannot control your blood pressure or heart rate after you rise. For up to 10 minutes after you stand, you may not get enough blood to your brain, resulting in dizziness and lightheadedness. /r/n/r/n Dehydration can occur in POTS because the condition interferes with your ability to retain fluids. One common problem involves the kidney hormones aldosterone, angiotensin, and renin, which regulate sodium and fluid retention. When inadequate fluid remains in your bloodstream, the reduced blood volume contributes to POTS syndrome. /r/n/r/n Other symptoms of POTS can include /r/n/r/n Cancer occurs when some of your body's cells mutate, grow uncontrollably, and spread to other parts of your body in a process called metastasis. The disease can start anywhere in your body. Cancer cells grow and multiply when they should not. Problems arise when these cells join together and form tumors or lumps, which can be benign, non-cancerous, or malignant, cancerous. /r/n/r/n Your fluid needs can be affected by the type of cancer you have. For example, people with gastrointestinal cancers have a higher than normal risk of dehydration due to factors such as nausea, vomiting, diarrhea, or trouble swallowing. /r/n/r/n Other symptoms of cancer can vary based on the location of the cancer cells. Some common symptoms of cancer are /r/n/r/n Addison's disease is a rare condition also known as primary adrenal insufficiency and hypocortisolism. With this disease, your adrenal glands do not produce enough of the hormones cortisol and sometimes aldosterone. Your adrenal glands sit just above your kidneys. The most common cause of the disease is autoimmune adrenalitis, a disorder in which your immune system attacks cells of your adrenal glands. /r/n/r/n Addison's disease and a shortage of cortisol can interfere with your body's ability to respond to stress and perform other normal life functions. Dehydration can occur as an early sign of Addison's disease. It is linked to insufficient levels of the hormone aldosterone, which regulates the balance of salt and water in your body. /r/n/r/n Other symptoms of Addison's disease are /r/n/r/n Gastroenteritis is a short-term illness caused by inflammation of the lining of the stomach and intestines. While it is often referred to as the stomach flu, gastroenteritis is not caused by flu viruses. It can be caused by many different viruses, including noroviruses and rotaviruses. It can also occur as a result of consuming food or drinks contaminated with viruses, bacteria, parasites, or chemicals, a condition called food poisoning. /r/n/r/n While gastroenteritis is not harmful to most people, it can become dangerous if it leads to dehydration. Dehydration is the most common complication of gastroenteritis because of the loss of fluids and electrolytes that occur with diarrhea and vomiting. /r/n/r/n In addition to dehydration, other symptoms of gastroenteritis are /r/n/r/n Hypothyroidism is a condition characterized by an overactive thyroid gland. It results in the overproduction of thyroid hormones. This can speed up your body's metabolism and its processes. While the condition can give you extra energy, it eventually causes fatigue because your body is not intended to maintain normal function at this accelerated rate. /r/n/r/n Dehydration can be a complication of hypothyroidism due to high body temperatures, sweating, and diarrhea. It can also occur as a symptom of a thyroid storm, a rare but life-threatening condition that causes severe dehydration and cardiac problems. /r/n/r/n Other symptoms of hypothyroidism are /r/n/r/n Sepsis, also called blood poisoning, is your body's extreme response to an infection. It is a life-threatening medical emergency that damages vital organs and tissue. Sepsis requires immediate medical treatment. /r/n/r/n Dehydration occurs with sepsis due to the external loss of fluid through sweating. Sepsis also causes internal fluid loss due to decreased oral intake of fluids, capillary leakage, and sepsis-induced vasodilation, widening of blood vessels to increase blood flow to areas lacking nutrients or oxygen. /r/n/r/n Get immediate medical attention if you or a family member is experiencing any of the following symptoms of sepsis. /r/n/r/n The best treatment for dehydration depends on the severity of the symptoms and the cause of the dehydration. Intravenous, fluid replacement is routinely provided in hospitals to deliver large quantities of liquids directly into the bloodstream of severely dehydrated patients. More recently, it has also been provided at drip bars, locations where you can receive fluids without a physician's recommendation. /r/n/r/ny. The water can help replenish fluids lost to dehydration, for therapy can replace fluids faster and in greater quantities. For therapy also provides an option to add lost vitamins, minerals, and electrolytes, as well as medications, to help your body heal. /r/n/r/n when necessary. 4 treatments are prescribed by a healthcare provider and administered by a medical professional trained in inserting and for and monitoring your response to treatment. The option may be especially beneficial to populations such as older adults and the chronically ill, who cannot replenish lost fluids solely through drinking water. /r/n/r/n while for therapy may also benefit other patients. The Federal Trade Commission, FTC, previously challenged claims by an for therapy company that marketed its cocktails to treat chronic diseases. The FTC warned that health claims made by for therapy drip bars must be supported by competent and reliable scientific evidence. /r/n/r/n if you have symptoms of dehydration, contact your healthcare provider for advice on restoring lost fluids and other treatments. Dehydration resulting from an acute or chronic medical condition may also require other medical treatments to offset complications and promote healing. /r/n/r/n dehydration occurs when your body loses or uses more water than you consume. Without proper water levels, your body cannot function normally. While mild cases of dehydration can be reversed with proper water intake, severe cases can threaten your health and well-being without medical treatment. /r/n/r/n you can help prevent dehydration by replenishing fluids with drinks and food. Watching for early signs of the problem, such as dry mouth, dizziness, and fatigue, can help you avoid severe effects on your body systems. /r/n/r/n certain health conditions can increase the risk of dehydration despite drinking proper amounts of water. Know the signs of dehydration so you can contact your healthcare provider for proper treatment as soon as a problem occurs. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.